Hello, this is Dr. David Tam, President and CEO of BB Healthcare, and I'm in my office alone so I can take my mask off. And welcome to our town hall today. It is Thursday, December 17th. It is 4 p.m. I share that with you because, of course, we'll put this as a recording later on. I wanted to make sure that everybody knew that this information and this town hall is for today, December 17th, Thursday at 4 p.m. Information changes rapidly as a result of COVID-19 and the vaccine, so I want to make sure you have the latest information, and as new information comes on, you know that we will be bringing it to you. As you know, we are here today. I'm at the Rollins campus here at the Lewis campus of BB Healthcare at the BB Medical Center. You also have our sign language interpreter, Pamela, sharing information so that all of you can be aware of what's going on. The first thing, of course, as we talk about today, is to share with you information about what's really exciting, and that is the news that Pfizer and BioNTech COVID-19 vaccine came to Sussex County, came to BB Healthcare, and we were able to vaccinate 5 team members yesterday in our first round. It's so exciting because the 5 team members were actually frontline healthcare workers. They were respiratory therapy, clinical nursing, a ICU physician, a pharmacy technician, and of course a housekeeper, an environmental services worker. People ask me, David, why didn't you get the COVID-19 vaccine first? And the answer is because even though I'm a physician, I am not a frontline healthcare worker. I want the people who are most at risk, who are facing these challenges every day, to get that vaccine, and that's what we're doing here at BB Healthcare. That said, as we continue to vaccinate people in the healthcare industry, we want to make sure that all of you have the latest information about the vaccine, because we have been diligently working with the CDC and the Division of Public Health to figure out the plan of how we start with our healthcare workers and then expand the vaccination process to everybody in the community. Today, I have with me my partner, Dr. Bill Chazanoff, to discuss the vaccine, some of the common side effects of the vaccine, the way we have worked with the state and the CDC in distributing the vaccine, and of course, other important information such as efficacy, how we store the vaccine, temperature, and handling. I also know that you have sent some questions in, and we'll be able to answer those as well. And we also know how important the vaccine is now as a tool in our fight against this pandemic. So before I hand it over to Dr. Bill Chazanoff, I just want to take 1 minute and tell you that BB Healthcare is working very hard every day on the front lines to take care of you and the community, both with respect to the COVID-19 pandemic as well as all your other healthcare needs. One example of the dedication and commitment and the expertise BB Healthcare has is Dr. Bill Chazanoff. I love living here in Sussex County. Today actually is my 9-month anniversary starting here at BB Healthcare. And I know for a fact, I bet that Bonnie Chazanoff, Billy's mom, is watching today. I don't want to embarrass Dr. Chazanoff, but that's what's really exciting about us working here at BB Healthcare, that we are your community resource. We are families taking care of families, neighbors taking care of neighbors. So I hope that you learned something today that you can take back with you as we continue together to fight this pandemic. On that note, I would like to turn it over to Dr. Bill Chazanoff, our COVID-19 Medical Director. Bill?
Thank you, Dr. Tam. I appreciate that, and I am sure that my mom appreciates that too, along with the rest of my family, so thank you. I want to start off by thanking everyone for joining BB Healthcare's Town Hall. We have been doing these now for several months, and I hope that you find these to be informative, because we continue to try and build upon the last one with additional and more updated information. So for those of you that do not know me, I am Bill Chasnoff. I'm an infectious disease physician here at BB Healthcare and have been here for about 3.5 years. As Dr. Tam had mentioned, I grew up in this area. I actually grew up in Milford and now live in Lewis. I serve as BB Healthcare's COVID-19 medical director, and I continue to work closely with BB Healthcare's population health and employee health team. So again, thank you for joining us. I have a lot of information to cover, and I have several questions towards the end and want to provide some websites and additional information towards the end. So here is your warning to grab a pen or a pencil if you need to write some information down. I generally start off by giving us some updated information with COVID-19 statistics. So the numbers that I'm about to provide are since the start of the pandemic. Since the start of the pandemic, which has been really almost a year ago at this point, the United States has confirmed over 17.1 million cases of COVID-19. Out of those known 17.1 million cases, we have unfortunately exceeded 309,000 deaths in United States citizens, and these deaths were contributed to COVID-19. The state of Delaware, like most places in the United States, has felt another surge of COVID-19. Recently, as of this afternoon, the state of Delaware reported over 48,000 confirmed cases in Delaware residents. And please remember, this is since the beginning of the pandemic. And we have unfortunately lost 845 state of Delaware residents due to COVID-19. Our hospitalization rates have unfortunately exceeded what they were back at the end of April and the end of May. And out of those over 400 hospitalizations throughout the state of Delaware right now, 58 patients are requiring critical care. We are worried and closely monitoring that these cases may continue to rise. So this is my first ask of all of us, even though we are going to talk about hope, that there are the 3 simple things that we can do to try to keep us all safe. And those are the 3 W's, which is wash your hands, wear a mask, and watch your distance. These important 3 W's will continue to keep us as safe as possible and will keep many people out of the hospital from becoming ill and potentially even saving numerous lives. So that's my first ask of everyone who's watching right now. Unfortunately, part of my job is to report those grim numbers. And that is, for those of you who know me, that is not what I like to do. So it does give me some significant excitement to share with you about some hope. Hope for not just BB Healthcare, but Sussex County, the state of Delaware, the United States, and the entire world. And the hope that I'm referring to is the introduction of the first COVID-19 vaccine that has received emergency use authorization. From another town hall, we discussed that process of what it takes for a medication or a vaccine to receive this emergency use authorization. If any of you were a part of that town hall, you would remember that colorful chart that I held up that had many points that had to be passed in order for a vaccine to receive review for its safety and efficacy. We discussed that those clinical trials are important for every medication and every vaccine, not just the COVID-19 vaccine, but for every vaccine and every medication that is approved through the Food and Drug Administration. At every single one of those points, the safety and efficacy of that medication or vaccine is reviewed. And at any point that it appears to be an unsafe medication or vaccine, that trial is stopped. So it's very important to realize that. This past Friday, December 11th, the first COVID-19 vaccine that was created under a joint adventure with Pfizer Pharmaceuticals and a company known as BioNTech reached an emergency use authorization from the United States Food and Drug Administration. I want to touch on the study, the clinical trial that led to the authorization, this emergency use authorization for this vaccine. The Pfizer-BioNTech vaccine study included over 44,000 participants. These participants were people from different backgrounds, races, countries, and ages. The clinical trials in this study took several months to complete because they needed to ensure that all of the participants had received their second vaccine in order to collect the data, look at the statistics behind that data, and then send it to the Food and Drug Administration for further review. Once those study findings were collected, they were sent to the Center for Disease Control and Prevention's Advisory Committee on Immunization Practices. It was also sent to the United States Food and Drug Administration's Vaccine Biologic-Related Product Advisory Committee for further review. So these are two separate committees that look at the safety and efficacy of any medication or vaccine. The Advisory Committee on Immunization Practices provided guidelines on who they felt should be the first people in the United States to be offered the vaccine. From there, the state of Delaware Division of Public Health then started to outline further plans in what they call their COVID-19 vaccination playbook that is available to everyone on the Division of Public Health website, talking about whom should receive the vaccine first and how that vaccine should be rolled out to eventually everyone in our community, the state, and then obviously the Center for Disease Control helps to outline that for the rest of the country as well. So we have guidance of whom the vaccine should be offered to first. So the ACIP, or the Advisory Committee on Immunization Practices, they went ahead and they provided the recommendation. Then the clinical trial, the study, was sent to the Vaccine Biologic Related Products Advisory Committee, also known as VBRPAC, and they, on Friday night, stated that this vaccine should receive emergency use authorization, which it then received. So that is the fantastic news that we are happy to share. It is important to note that this emergency use authorization that came to us less than a week ago on Friday was a few days after the United Kingdom and Canada had already authorized the vaccine for use in their country. So we are not the first country, but we are one of the top countries to provide an emergency use authorization for this Pfizer COVID-19 vaccine. I think we need to spend a moment or two to talk about something I hear frequently, and that is this vaccine was created so fast and so quick. How can it be safe? So I think it's important to recognize how this vaccine seems to have been created so quickly. The first thing that I want to mention is that we live in 2020, which is an amazing time, and that the things that have happened to create this vaccine from a science, medicine, and technology standpoint could not have happened 30, 40, 50 years ago. So first of all, it is partly because of the time that we live in. One of the other main ways that it seems to be that this vaccine was, quote, created so quickly was that normally in a process, pharmaceutical company will have a new medication, a new drug, a new vaccine, and it will go through a series of these trials that we talked about, these clinical phases. And at each step, they stop and pause, which occurred here. They look at the safety and efficacy of that new drug or that vaccine. Then they move it to the next step. And then the next step, then the next step. And finally, it will reach the FDA for a final review. When that normally happens, which is a little bit different, so this is the part that's going to be different with this COVID-19 vaccine, after it receives FDA approval, that's when we start to manufacture the vaccine, followed by distribute it. This part, this manufacturing and distributing part, actually started to occur earlier when this vaccine was in its clinical phases. So if it did not, and it being the COVID-19 vaccine, if it did not achieve the checkpoints and the reviews that it needed to, all those vaccines would have been discarded. But because we were fortunate enough to have a vaccine that made it through all these checkpoints, made it through the committees, was reviewed by the FDA, and was accepted for emergency use authorization, we luckily had already started to manufacture that vaccine and start to place this in warehouses. So when the green light was given on Friday, on December 11th, within days, we had vaccine that was able to be distributed to states for further distribution. That's pretty amazing. That is a huge that's a huge thing to uphold, because all that vaccine would have been discarded if it did not meet the requirements that the FDA and the CDC were looking for. So I do want people to understand that even though this seems fast, all the checkpoints were completed in order to make sure that we have a safe and effective vaccine. I also want to point out that while I'm discussing the Pfizer vaccine, which is the first COVID-19 vaccine in the United States to receive emergency use authorization, not too far behind is another COVID-19 vaccine that is very similar, that has been created by a company called Moderna, which is Moderna, Moderna. So we do expect Moderna's COVID-19 vaccine to receive, if everything looks good, to receive emergency use authorization within the next few days to week or two. It uses the same technology as the Pfizer vaccine, and they had over 30,000 people enrolled in their clinical trial. So between the Pfizer and the Moderna vaccines, that's over 74,000 people who were enrolled in the COVID-19 vaccine trials. That's pretty impressive. So this is not just 100 or 1,000 people who were a part of these trials. This is over 74,000 people. So I think it's also important to talk about what we do know about the Pfizer vaccine. And with that, I'm also going to talk about what we don't know at this point about the Pfizer vaccine. We know this vaccine, after someone receives the second dose, is more than 90% effective. We know that this vaccine requires 2 injections, approximately 3 weeks apart. We know that this vaccine has very strict safety, handling, and temperature monitoring, along with security guidelines. This is different than other vaccines that we have had to store before. We know that this vaccine was used in the United Kingdom about a week or so before we had it in the United States for its first administration. We also know that a couple people in the United Kingdom did have an allergic reaction or an allergic-like reaction to the vaccine, and we will talk a little bit about this because we have some questions about that later on. We also know that this vaccine is potentially the beginning of the end of the COVID-19 pandemic, which I think gives us all hope. We know, though, that this vaccine, from a healthcare perspective, will not allow us to stop wearing the PPE that we know keeps us and our patients safe in the hospital. We also know that this vaccine will not immediately allow us to stop following the 3 W's: washing your hands, wearing a mask, and watching your distance. And we also know that this vaccine will save numerous lives, hospitalizations, and illness. I'd like to switch to tell you some things that it's fair to say that we do not know about this vaccine. While this vaccine was not specifically studied in patients who were pregnant, during the clinical trial, several patients did become pregnant. So we do not know what the effects on pregnancy are, although pregnancy is not a strict contraindication to receive the vaccine. Now, those people who did become pregnant during the study will continue to be followed. We do not have specific data on patients who are immunocompromised or take medications that lead to their immune system becoming, we're just switching off right now. Sorry about that. So what I was saying is that we do not have specific data on patients who are immunocompromised or take medications that lead to immune suppression. We do not, again, have a contraindication for people who have an immune compromising medical condition or that take medications that reduce their immune system to not have the vaccine, but it is important to talk to your primary care or your provider who either treats that disease and or provides medications to help treat that disease if this vaccine is right for you. The other thing that we don't know is how long will the immunity from the vaccine last? So when someone receives the 2 doses of the vaccine, will the immunity for COVID-19 last for a year? Will it last for 2 years, 5 years, or for a lifetime? Will it require a booster vaccine like we use in certain other medical diseases, such as tetanus? We know that every 7 to 10 years that we generally are offered a tetanus booster. So those answers we just don't know right now. And I think this is probably a good point to switch gears, but along those same lines of talking about the side effects and what we do know from a side effect standpoint of this vaccine. The most common side effect that's reported is what we call an injection site reaction. And just like it sounds, an injection site reaction is the place where that vaccine is injected. I may have some redness, I may have some swelling, and I may have some pain. That is not unique to the COVID-19 vaccine. That is a common side effect for many vaccines. In addition to those common injection site reactions I spoke about, the clinical trials have stated that some vaccine recipients, so people who receive the vaccine, do develop fever, fatigue, headache, chills, sometimes GI symptoms such as the feeling of nauseousness, along with muscle aches after taking the vaccine. What is interesting about this vaccine is that this tends to occur more commonly after receiving the 2nd dose of the vaccine than the 1st dose, but it can occur after the 1st dose. It is also important to realize that this vaccine is not a live virus vaccine. No, this vaccine does not contain any live virus, which is very important and an important question that I receive quite a bit. Those side effects that I talked about after some people, because not everyone will have those side effects and most people will not, but those people who do develop those side effects, such as not feeling well or having muscle aches, having some fever or headaches, most of the time that occurs because our immune system is responding to the vaccine. Our immune system is ramping up and creating antibodies towards an infection, and in this case, we're referring to the COVID-19 infection. This is not an uncommon phenomenon to happen, and happens for some people after they receive the flu vaccine or the pneumococcal vaccine and other vaccines. Some people have that feeling after they receive a vaccine, and certain people have that after receiving just certain vaccines. So it is not uncommon to have those side effects that we have mentioned. I do want to talk about, because we had mentioned in the United Kingdom that there were a couple people who had an allergic-like reaction. Now, they developed an allergic-like reaction after receiving their 1st dose of the Pfizer vaccine. What has been reported is that when their medical history was reviewed, it appeared that they had a history of having a severe allergic reaction to either a food or medication that was not related per se to the vaccine, but to another food or substance. So that has obviously made us have some precaution for people who do have severe allergic reactions to certain foods, to other medications, or also I include insect stings or bites. So if someone does have a severe allergic reaction, and what I mean by a severe allergic reaction is that they have required medical attention or they have required medication to treat an allergic reaction such as an EpiPen, or they have been advised to carry or should carry an EpiPen because of a prior allergic reaction, it's important to know that before they receive this vaccine, they should have a conversation with a healthcare professional. It does not mean that they cannot get the vaccine, but there are certain things that should take place, such as extra monitoring and an individual decision between the person who is giving the vaccine and who's receiving the vaccine to make sure that that the person receiving the vaccine still would like the vaccine. As more time progresses, we will know if these just happen to be a few isolated reactions or if this tends to be more common than what we've seen. Now, at this point, the United Kingdom has given thousands of vaccines, and those are the two that have been reported, at least publicly. So even if that was due to the vaccine, it appears to be a very, very, very low percentage. But it is important for anyone who has had a severe allergic reaction, not even to just a vaccine, but to another drug, a food, or an insect bite or sting, to please talk to their healthcare professional before having the vaccine for COVID-19. So what is next? So as more COVID-19 vaccine is manufactured and becomes available, more people will obviously be offered the vaccine. And as I had shown you before with a COVID-19 vaccination playbook from the state of Delaware, and the Centers for Disease Control has a very similar playbook, there will be a risk-tiered system that is presented for people to receive their vaccine. So in the United States and in the state of Delaware, in the top tier, which we call 1A, A is an apple, that includes healthcare personnel and residents and team members working in a long-term care facility. So after those people are offered vaccine, or as more vaccine becomes available, then that will be extended to more parts of our community. So I expect all that to continue to increase over the next several weeks. And that's one of the many questions that I've been asked, and I will try to be more specific and answer specific questions when we get there. The bottom line is that I and Dr. Tam and BB Healthcare and everyone wants everyone who would like a COVID-19 vaccine have that vaccine. And I think that vision can happen, but it's just going to take several weeks to make that happen. So patience is important, but it's being worked on. And as more and more vaccine becomes available, then more and more people are going to be offered the vaccine, which is amazing. And I hope that makes everyone happy as it makes me. As Dr. Tam had alluded to, I am also happy to announce that something historical happened last night here at BB Healthcare. As Dr. Tam announced, we were able to vaccinate several of our frontline healthcare workers. These are the workers who have been on the forefront of this COVID-19 battle for months now. I mean, these are the people who are taking care of our community and what an honor it was for us to be able to start offering this to our team members, to do what we can to try to continue to keep them safe, which in turn will help keep the entire community safe. From that, I hope you all feel the hope that I feel, that this is truly the beginning of the end of this COVID-19 pandemic. You know, receiving the vaccine at first is going to feel a little strange, and not by actually having the injection of the vaccine, but when we start to expand the people in our, in our healthcare team, but also in the community to receive the vaccine, things are not immediately going to go back to normal. Like I told you before, we are still going to wear our personal protective equipment. We are still going to have masks on and goggles and gowns and gloves as appropriate. We're still going to follow the 3 W's, washing our hands and watching our distance and wearing a mask. All those things, despite this vaccine at the beginning, are going to remain the same. And it's completely important for all of us to remember that. And with that, I feel as though we have talked about so much, and this is so much to probably just take in. But I do want to talk just about a couple other things very, very quickly. And one of those things is that the state of Delaware, their Division of Public Health, has a page that you can go to. So I ask everyone to go to the State of Delaware Division of Public Health page. They have public forward-facing information that talks about when people will be vaccinated in their plan. You can actually look at the COVID-19 vaccination playbook that's updated on a regular fashion. And the other website that I want people to be aware of is the bbhealthcare.org website. We will continue to push out information to our community and to everyone to let you know what's happening from our perspective. And as more information comes to us and more vaccine becomes available, and as we extend vaccine, the limited amount that we have right now beyond just our team members to, our extended family, we're going to let you know that because we want you to have the vaccine. This vaccine is hope for all of us. I'm going to answer a few specific questions now. And I hope that this is helpful for not only the people who have asked, but also for everyone that's here. How long is the shot good for, and will it have to be an annual vaccine? So we talked a little bit about that, but to specifically answer that, we're not quite sure right now. The initial series of the Pfizer vaccine is 1 dose, followed by approximately 3 weeks later, you receive a 2nd dose. At that point, there are no plans at the moment to determine if you need another booster in a certain amount of time. Now, that sounds like a wishy-washy answer, and I'm sure that, you're like, well, I just want to know if I need a booster. So how do we find that answer out? I think that's the most important part. The clinical trial is not closed. So this Pfizer vaccine that I told you 44,000 participants were enrolled in, this will continue for several years. We will continue to follow people. And by we, I mean the medical community will continue to follow these 44,000 participants. As they continue to be followed, we will receive likely that answer and several other answers. I am over 65. If I wanted to get the Pfizer vaccine specifically, where could I go to guarantee that I will receive this vaccine? Very good question. So it's important to realize that the Pfizer vaccine is very similar to the Moderna vaccine. So for almost all intents and purposes, that the Pfizer and Moderna vaccine are pretty much, while different companies, are pretty much the same technology and are created the same way. So I wouldn't pin yourself down to just the Pfizer vaccine, realizing that there's also a similar vaccine that's out there. When it becomes available, when the Pfizer and Moderna vaccine become available, that will be displayed and presented on the Division of Public Health website. As we continue, and by we this time I mean BB Healthcare, as BB Healthcare continues to work with the State of Delaware Division of Public Health and ultimately the Centers for Disease Control, we will also present that information on bbhealthcare.org and also likely through our Facebook page. I'm going to go to another question now. I have had COVID-19 and recovered. I am giving antibodies. The Delmarva Blood Bank collects antibodies from COVID-19 patients 14 days after symptoms resolve. When should I get a vaccine? The CDC does not seem to provide any instructions. Well, first of all, I want to thank you for giving convalescent plasma, which is where those antibodies that the Blood Bank of Delmarva collects. So for those of you who have done that, that is an amazing service that you have provided to many, many people, just not in our community, being BB Healthcare's community in Sussex County, but the entire state of Delaware and the region. So thank you for doing that. With that being said, the current recommendations are that someone who has recovered from COVID-19 should wait for approximately 90 days before starting to receive the vaccine. Now, it does not mean that if you receive the vaccine that something bad would happen to you, but what we do know from current medical literature is that you have immunity and or likely have immunity to a reinfection of COVID-19 for at least 90 days after your recovery. Now, after that 90 days, we do not have good literature to say that there is ongoing immunity. So we recommend after 90 days of recovery from COVID-19 that you then consider receiving the COVID-19 vaccine. My next question is, what, if anything, would happen if a person who is asymptomatic and unknowingly is positive for COVID-19 did take the vaccine? Could this harm the patient? So at this point, the answer is no. We do not believe that someone who had an asymptomatic infection of COVID-19 would have any harm from receiving the vaccine. My next question is, let's see here. My question is about people who have a history of anaphylaxis due to medicine or food allergies. How will that shot be administered? I assume in a medical setting. So the simple answer is I would assume that too, and I'm going to say yes. That should be administered in a medical setting where someone could be monitored. So if someone has a history of anaphylaxis due to a medication, another vaccine in the past, or a food, then it is important to speak to your healthcare provider about the risk and benefit of receiving the COVID-19 vaccine. If the decision is made to move forward with a COVID-19 vaccine, then at that point, it's important to let whomever is administering that vaccine know so they can set up any extra precautions in case they would like to monitor you for another 15 to 30 minutes or longer after receiving the COVID-19 vaccine. I have a history of bad allergic reactions to medications. I am unable to take penicillin, sulfa drugs, morphine, Benadryl, and epinephrine. I also have a peanut allergy. Should I get the vaccination? So this is interesting, and I say this because someone who has bad allergic reactions to medications that we generally use to treat allergic reactions, such as Benadryl, also known as diphenhydramine, and epinephrine, I would ask you to please speak to your medical provider because you would need to likely be in a setting that is at least close to an urgent care or medical hospital if the decision was made to move forward with a vaccine. This is an individual decision between whomever's asking this question, and I'm assuming this person has an allergist or immunologist with this type of vaccine, with this type of allergy history, that I would absolutely bring up to my allergist or immunologist. Next question is, I have read that after receiving the second dose of the COVID vaccine, a person may get ill with the effects lasting a day or so. Have you received such information? The report indicates side effects can include fever, chills, muscle aches, and bad headaches. That is true. So there is a certain percentage of people who will have those type of side effects even after the first dose. But as you discussed in this question, the second dose tends to be the dose that is more likely to cause those side effects. It is okay. It is okay if you do develop those side effects to reach out to your PCP, because they may prescribe medication that may make those side effects less painful, such as the muscle aches or the headaches. They may prescribe a Tylenol or another medication for you. My next question is there any greater risk of the vaccine due to the new vaccine technology than any other vaccine, such as the shingles vaccine? That's a good question. So I'm going to answer this by talking about that Pfizer had 44,000 participants in their trial, and that Moderna, which is approaching emergency use authorization review, had another 30,000 for this technology. When we talk about shingles vaccine, there's actually two shingles vaccines out there. There's the Shingrix, which is a recombinant vaccine that's been on the market for a few years now. And there is the prior shingles vaccine known as Zostavax with a Z, Zostavax. And that's actually a live vaccine. That's a live virus vaccine that had a lot of contraindications to it. And a lot of people were unable to receive Zostavax. So I would say that there's not any greater risk from the COVID-19 vaccine than any other vaccine, but there are certain people who will need to talk to their healthcare provider about if the COVID-19 vaccine is right for them. And we talked about some of those with people who have had a history of severe allergic reactions. I'm going to answer a couple more questions from time's sake, and then I'm going to pass it back to Dr. Tam, but I do want to get to a couple more. One is, how and when will BB provide the COVID vaccine to seniors who are patients of BB physicians? So once the vaccine becomes available to the community and those with certain risk factors, we will announce that information not only through the Division of Public Health website, but we will also announce that to our patients through bbhealthcare.org, and then also through the practices themselves. So this is a really good question. As a matter of fact, we were discussing this earlier today to start our preparations and continue our preparations to get everyone ready for this, which we are very excited about. The next question also is just a continuation of this question. Is BB planning to set up public vaccination events for those over 65? If so, when and how can I register? Well, I'm hoping that whomever asked this question is someone who went through one of our many successful flu clinics this year or in the years in the past. As many of you know, BB takes pride in our flu clinics throughout the communities in Sussex County. What this vaccine, this Pfizer vaccine, does pose are some additional storage, handling, temperature control, and security measures that we are discussing how we may be able to present this to the community, maybe not in like a drive-up fashion, but in a safe fashion that we can control all those factors I talked about with this vaccine, but also making sure that the community has access to this vaccine. It's really important to make sure that everyone has the opportunity to get this vaccine when it is available. Um, I think at this point, those are the big topics of the questions that I have. And I want to thank you very, very much for your time. I want to remind everyone to follow the 3 Ws: watch your distance, wear a mask, and wash your hands. And of course, I'm here at BB Healthcare if you have any questions. And it is my pleasure to turn this back over to our president and CEO and my colleague, Dr. David Tam. Thank you.
Thanks, Bill. I hope you can hear me now. The three most words that are spoken in 2020, you are muted. And I'm just as guilty as the next. What I did say was thank you, Bill. Thank you for all that you do. And I'm sure that Bonnie and Shay, you must be very proud of him, as are we here at BB Healthcare for all the work that he has done, as well as everybody else on the team. Once again, for all of you who are watching live right now, thank you so much for joining us. Please remember, though, that it is Thursday, December 17th, 4 p.m., and we're recording this. What does that mean? It means that it will be posted on Facebook as well as other social media venues. Please go ahead and share this information, share this link with everybody who who you want to share it with, because the information that we have shared is the most up-to-date and contextually what we are doing here in Sussex County to take care of our families, our neighbors, our communities, and our friends. Just a couple things before I close. Number one, it is our commitment here at BB Healthcare to provide for the health of the community. I want to reassure you that the hospital is active, the hospital is vibrant, we are open, and we are taking care of patients in our emergency, in our ICUs, in our medical floors, in our clinics, in our walk-in areas, labs across the county. We are doing everything as safely as possible with COVID, and we want to make sure that you all not are treated for COVID, but also treated for all the other things. Remember, heart attacks, strokes, appendicitis, deliveries, all those things, all the things that occur still happen whether the pandemic is here or not. And BB Healthcare is committed to making sure that we are available and ready to take care of you for all your healthcare needs. Please, please, please continue to see your doctor. Get your prescriptions refilled. Get the labs that you need to check your blood sugar. Make sure that your blood pressure is checked, because we want to make sure that you are healthy and safe as we get through this pandemic together. You've heard so much information from Bill about our vaccination process, and you need to continue to listen to all the different news medias and the people you trust in terms of what is happening. And if you have more information or if you have more questions that you need, please remember that we will continue to do this on a regular basis, and that you can always email us or ask your doctor about some of the questions that you have with respect to this pandemic and the vaccination. Christina, if you don't mind, I'm going to ask you to put up that photo that I asked you to, if you can, so people can see something as I close. Let me know when it's up, Christina. There we go. Dr. Chazanov talked about what I think and what he thinks is a historic event that occurred yesterday, where we, as I shared with you at the beginning of this, vaccinated 5 of our frontline healthcare workers. We're committed to vaccinating all of our healthcare workers, but the front line come first. Why am I showing you this? When I saw this I have to tell you that I've been here for 9 months. It's been a crazy 9 months. It's been the best 9 months of my professional career. What you see there is a picture of a nurse in our emergency room. Her name is Cynthia Rodriguez. Cynthia and I actually met in May when we were doing a live testing event, a walk-up testing event in Georgetown. And if you think about where we were back in May, where it was it was Georgetown was the hot spot. Things were ramping up. People were getting sick. Cynthia and I stood there in Georgetown, and we did a Facebook Live event there where we talked about why it was so important for people from Georgetown to come out and get the testing done for COVID-19. She did it in Spanish, and it is this picture just reminds me of the importance of how we are a community healthcare resource. We understand the community. We understood the Hispanic community, the Haitian Creole community, in how they saw COVID-19. And it wasn't David talking, it was really Cynthia talking and sharing why it was important for the community that she represented to come and get Facebook, to get the live the testing event and get the COVID testing done at that time. Thank you, Christina. You can go ahead and put it away. And it was so important, therefore, to see Cynthia be one of the first nurses to get that vaccination. The last thing I'll mention as we close. You might have heard recently, I don't think Dr. Chazanov talked about it, but recently we've received information from the FDA that these vials that we receive, and you've seen pictures of them from Pfizer, they're supposed to hold 5 doses. It turns out that they actually hold 6. What does that mean? It means that we can get 20% more. We can do one more injection, one more vaccination out of that vial of 5. Now we can get 6. That's more people that can get the vaccination, more healthcare workers, and eventually more people out in the community. All of you get vaccinated with what we have allocated to us. And I just couldn't help but finish off with thinking about how that reminds me of, where we are today. Today is, I think today is the 7th day of Hanukkah. And, I shared this with the team that as the celebration of Hanukkah is represented by lighting that menorah candle, right? The candles, where the story goes that the Jewish people only had enough oil for one night for that candle to be lit, and it lasted actually miraculously for 8 nights. And that's why they light the candle the way they do, that there is hope. Everybody has been praying for this. I know I have. And now we have the vaccine. And isn't it amazing that it turns out that the 5 doses really turns out to be 6 per vial? There's so much to be hopeful for, and we can get through this together. We just need to continue doing the things that have brought us to this point. Wear your mask, watch your distance, wash your hands, and of course, take care of your health so that you don't end up in the hospital with something else other than COVID-19. And if we do all those things and prepare for the vaccination and take the COVID-19 vaccine when it is available, I'm sure that we will get through this together, and I am so excited about the idea that I will be able to, with my family, celebrate and enjoy all the things that Lewis, Rehoboth, Georgetown, Millville, Sussex County has to offer in 2021. Thank you so much for all you do. Thank you so much for your support of BB Healthcare, your local, independent, nonprofit community health system, and happy holidays to all of you. Let's all pray for a blessed and happy and healthy 2021. Have a good night.